Now, self-medication, we've heard this for a very long time now. Of course, it's not something very recent. It's been done since ancient times because people believe that they know their bodies the best. Let's talk about self-medication itself. Self-medication is now a societal phenomenon that's influenced by a variety of information and treatment options. And could you please comment on this and what we start off with? What does self-medicate means?
Okay, so basically, self-medication or self-medicate means that you try to identify what's wrong with your body and you try to see, okay, this product might work for me. So you don't seek professional help from doctors or pharmacists. So instead, you try and see what is accessible to you and you use those products or those medicines to try to help yourself to improve your condition. So currently, I think there is an increasing trend. There's increasing prevalence, especially now that everything's just at the end of our fingertips. So it's easily accessible online. You can just search up the condition that you're having, the symptoms that you're having, and lots and multiples of differential diagnosis. Basically, they might say you might have this, you might have that. So you would see that and say, okay, if I have this, what are the treatments that I can take? So you might look at that and you'll just go to the pharmacy or just go online and search for the product and you'll be like, okay, we're good to go. So I think that's the summary or in simple terms of self-medication.
I think the influx of information and technology has really helped out
Yes,
in that
correct.
particular area. But of course, sometimes what we know, what we think we know, and what's actually happening could be very
Yes,
different
that's
things.
why it's best to seek professional help.
Always seek professional help whenever you need it. Now, what are some of the factors that you believe that might encourage the public to actually to self-treat their pain?
Okay, so I think if you want to say what are the factors, the common factors might be two of it. The first one I think is cost-wise. So currently, like living, we have there is a rise in,
Living costs.
living costs. So that might be you see, people will tend to treat themselves because it's easier. They don't have to go see the doctor. They don't have to pay. And also it's time consuming to go to the doctor to wait for hours, especially if you have chronic conditions. So people will opt to go for a pharmacist only. They can just go to the counter and say, okay, I have this. What do you have for me? So those are okay because they seek the advice from the pharmacy. But what's not okay is if you go to the pharmacy, you just take the item that you think is helpful for you and you just pay it without
Yeah.
advice. So that's a bit harmful. There are risks and consequences to that. So also, especially like you said, everything is just online. So people can be influenced by others. So they can read some Facebook posts or nowadays.
Testimonials.
Yes, testimonials. Some of those are not even legit. So
Yeah.
the testimonials are from the company itself.
They just hire people
Yes,
to
they
do it for
just
them.
hire people. And also from WhatsApp groups nowadays, people would say that,
Yeah.
I've had this, so I took this and it works. So people be intrigued to try those products. So, but like we know, one drug does not fit all. So some might be okay with that, but some might not be okay. So like I said, there are risks and benefits to everything. So we need to think wisely. So at the end of the day, without any proper consultation or advice, it's best to just not do it.
Yep.
To seek help.
Yep,
Yeah.
seek help first. Like I actually have a story on this one because I used to have terrible, dandruff issues back in the day. So the thing was, one of my friend had the same problem, and he said, "You know what? Use this medicated shampoo. It's really, really good for your head." And I was like, "Okay." It just made it worse. Everybody's body is different.
Yes,
Yeah.
correct.
And what are some self-medication practices? Like what do people do?
Okay, so I think in terms of practice, in Malaysia, we can commonly see two types of practices. So the first one is if you have common symptoms, which we call mild sickness. So these are typically like if you have cough, cold, or runny nose, then people would just go to the pharmacy and just get some things that they think is suitable for them. And also the second one is in patients who have chronic diseases such as diabetes or hypertension. So these people, they might go to the doctor at first, they get the diagnosis, and the doctor will say, okay, you should start on drug A. So then they think, okay, drug A works for me, let's continue this medication and just get it off counter at the pharmacy each time I go there. But actually, you need to do a proper follow-up every 6 months or so, depending on your condition. So the doctor will see what's your disease progression. Is it getting worse? Is it getting better? So if it's getting worse, the doctor might change your medication, or they might increase the dose.
Yeah.
And also, if it's getting better, they might reduce the dose or just reduce to a slightly more mild, I would say, medication. So it's not always that medication the whole time.
Yeah,
So
one size does not fit all.
yes, exactly. So those are the two common practices seen here in Malaysia, I'd say.
So first get the diagnosis, and then after that just get the same medicine and just follow that.
Yeah.
Or even the other one, as you said earlier on, right? And of course, a lot of people also they just like to ask, like maybe they have family and friends who are doctors.
Yes.
They just like to go and informally consult, like, hey, my friend has this, lah.
Yep.
What should he do? And then they'll be like, oh, okay, I'm at a dinner right now, but I'm just going to give you something.
So that's harmful because they are not in a professional setting, so they won't be focused.
Yeah.
And also they can't see you face to face, especially if you just
Yeah.
call. So they would need to see who you are. So how is your condition to know what's best.
Yeah, I mean, the body is holistic, right?
Yes.
One can affect the other, so
Yes,
one
correct.
medicine does not work for all. Now, typically, Afifa, what are some examples of situations, experience, or illnesses that are often self-treated by patients that you have encountered? And then we'll move on to the continuing question in just a bit. Maybe you can
alright.
answer this one first.
All right, so I think the most obvious answer would be COVID-19.
Oh.
Because although it's sort of under control currently, but it's still here around us. So I think, especially now that the government has loosened the restrictions, so you can just self-quarantine, and if you're mild cases, you can self-medicate, self-treat at home. So I think that one is okay, but provided that you seek advice and help from doctors and pharmacists as well. So I think the common misconception with COVID-19 is that some people would demand from doctors that they see that they would need an antibiotics. So, but that is a misconception because COVID-19
It's
is
a
actually
virus.
a viral infection.
Yeah.
Yes, correct. It's from virus. It's not from bacteria.
Yep.
So it won't really work. However, there are some things that you need to keep to treat to help with the COVID-19 symptoms. So as I mentioned, to treat the symptoms is not to treat the condition.
Yeah.
So some of the things that is essential if you have COVID is paracetamol. Obviously, it's for
Yeah.
the fever and for the body pain or headache. And also the second one, you will need some antihistamines. So antihistamines will help with your runny nose or if you have any itchiness. And then the next one, you will need some sore throat medications, either the gargle ones or the lozenges. So, but it's also optional. But it's best if you have the self-test kit and also the oximeter to help to monitor your progression. Either it goes bad, then you would know when to go seek professional help.
Absolutely.
So, but other than that, you don't really need antibiotics, or even for antivirals for COVID, there is one specific one only, but there is only we reserve that for people who meet certain criteria. Yeah, so we can't just go to any doctor say I have COVID, give me antibiotics. So that's not a good practice.
Yeah, actually, you know what? Antibiotics is not the cure-all
Yes,
medicine.
correct.
It's just if you have a bacterial infection and you need antibiotics, of course, you have to finish the dose, run the course properly. And just a follow-up from the earlier question regarding, self-treatment by patients and also the examples of situations. Is it safe for children? Is self-medication safe for children?
Okay, speaking of children, sorry, it's a slightly more complicated because children, their body react very differently to adults because adults' organs are well developed compared to children. So there are a lot of medications which are safe in adults, but it's not safe in children. And talking about safety in children, there are some drugs which are safe for certain ages only. So especially for those below 2 years old, there are a lot of medications that we can't give. So there are some people who would say that, oh, my niece takes this, but the niece is like 6 years old and her daughter, her child is 2 years old. So those medications can't be shared to among themselves. So you have to look at one specific patient at a time. So in terms of that, I would say it is okay to self-treat, but to a certain extent. And yes, with help from the pharmacist or the doctors.
Absolutely. And there's also, I think, one of the negative effects or one of the negative aspects of self-medication is, you mentioned it very briefly, medicine sharing. right? A lot of people tend to do that, especially if they have
Yes.
almost similar symptoms. Even if it's a cold, it is not suggested to do
Yes,
so, right?
correct. Because different people, like especially in children, we will give the dose according to their body weight.
Yeah.
Yeah. So some people would think, oh, she takes 5 meals. I'm gonna give my child 5 meals as well. So it's not a good practice. It will be maybe helpful if it's the correct medication, but it might not be the best.
Yep, especially dosage. Dosage matters, people. Like, just a little bit can kill. Right, so let's talk about chronic patients who self-medicate without understanding the impact on their disease. So what's your opinion on this one?
Okay, for this one, so they typically chronic patients who self-medicate, it needs to be limited to a certain extent. Actually, in my opinion, it's quite harmful. Like I mentioned before, if you don't have a proper follow-up, so you would continuously take the same medication over and over again. Let's say it's not effective anymore for you, but you keep on taking. So instead, you're just posing yourself or your body to the side effects. So it's not working on you. So it's not helping you in your health, but it's giving you more problems.
Yeah.
So you won't see it at first, but over time, it can lead to more complications and worse, organ failure. So especially if, let's say, it's not effective, but you're taking the medication. So if, let's say, you have diabetes or hypertension, there's a high risk of kidney failure or liver failure and also heart problems. So if, let's say, those are not treated correctly, this can lead to more problems in the future, and those problems are costlier. It's more costly. So it's not actually saving money, essentially, if you think about it in the long future. Yeah, and also because, like I said, it's important for a doctor to know what's up with your body. Yeah, so they can give you what's the proper treatment.
Yeah, absolutely. I mean, the most important thing is, one of it is the type of medicine. The dosage is also absolutely important. And I think there's a idiom that says that everything in moderation, right? You know what? So I think that also applies to dosage, right?
Yep.
Everybody has to apply them in different kinds of way. Just off topic for a bit, there is also people who self-medicate. Like, for instance, someone who's already going through treatment in a modern medicine facility, but then they will tend to self-medicate with traditional medicine at the same time. Have you seen cases like that?
Yes, I've seen it a lot, especially in chronic patients. So, for example, they've taken the medication from the clinic, but they think it's not enough. So then they would most of the cases that I see are patients who read these advertisements online.
Yeah.
And they would say that, okay, this person sells supplements which are helpful for
My conditions,
hypertension
yeah.
or for my knee pain, something like that. So these medications, I think you need to check because a lot of these which are sold online or from unauthorized sellers, a lot of them are not legal.
Yeah.
So they are not registered with us. So it might contain some harmful ingredients. So you need to check on that. And also, if the doctor, for example, those can have interactions with the medications that you're currently taking. So if there is interactions, it can either cause the medication to not work as effective, or it can cause the medication to be more toxic. Yeah. So those are the risks involved with taking medications from outside.
Yeah, absolutely. Now, Afifa has stated right. Don't take another kind of medicine, especially if you're already on modern medicines and you've already been prescribed. Now, of course, you have already touched about antibiotics being a form of self-medication as well. Asking for antibiotics when your state does not require for it in the first place. Before we move on to the next question, we just have you can answer this very generally, of course. Like, for instance, Sila Che Ayub has asked a question. Hi, Afifa. Let's say I have my own set of medications for mild symptoms of fever and flu. To what point should I self-medicate before I finally go and seek medical attention from a doctor?
Okay, all right. Thank you for the question. So in terms of mild symptoms, so I would say, as I've mentioned before, we are treating the symptoms if we self-medicate. We are not treating the cause. So let's say you've been taking this medication for at least 3 days, and then you're still having the symptoms, nothing's working, you're still feeling very sick, then it's best for you to seek medical advice as soon as possible, because it might mean some underlying cause. For example, you might be having dengue or malaria or even some other serious infections. You need to get it checked. Or another example, which is quite common, is if patients say they have heartburn. So usually that is associated with GI or gastrointestinal problems. So it would take some antacids, which are gastric medications. But then if let's say they've taken it over some time and it's still not working, so you need to know that heartburn is also typically a sign of heart attack. So it might be something more serious. So you need to get checked. So basically, if you've tried taking your medication and it's not working, please seek help.
Yes, absolutely. I mean, not everyone has the answers, and sometimes we don't even know what the answers are for ourselves. So, Asila, I hope that answered your question. And right now, let's talk about tips and guidance that patients and the public can practice if they want to do self-treatment. What are your tips and guidance?
Okay, so I think first and foremost, if let's say you are interested or you are intrigued to buy some medication online or from the pharmacy, first you need to check the registration status to make sure it's safe. So there are two ways you can check. You can go to Quest 3, that's a website developed by the NPRA, which is the National Pharmaceutical Regulatory Agency. So the next one, we have this app called the Pharma Checker. You can check these online. Yep. The next one is, please do not be easily influenced by what people say.
Yep. A lot of people just want to make money.
Yep, correct. And even if you trust that person, they might not know what they're saying. They're just following what others say to them. Yep, so it's not safe. So, and also if you are buying those things, please read the label and also the product leaflet, so you know if, let's say, for example, you are pregnant or you are breastfeeding, some of the medications are not suitable for you. So you need to read, is it safe for me? Yep, so please read what is the ingredient, how to take it. So those things are important. And also, if, let's say, you are going to the doctor, to the pharmacist, please bring all the medications that you are currently taking, including your supplements or traditional medications, in the original packages, so that we can know what is the medication that you're currently taking. Sometimes patients would give us just pills. It's just white and round, so they'll be like, okay, ni ubat apa? But we don't know because there are a lot of medications which are white and round.
Yeah.
So please help us do our job as well.
Yeah. The KKs, I don't think they have a spectrograph to be able to understand what pill that is. Yeah. But you know what? Yeah, always make sure, like, even my suggestion is you should always keep your boxes with you, even if you already took the pills, just to create a history. At least take photos.
Yes, in case there's an emergency and you're, for example, hopefully this won't happen, you're unconscious, so then your family member would know, okay, these are the medications that this person took.
Yes, absolutely. And also make sure that you disclose to your doctor, even if it's something you did, like you took another supplement, but you don't want the doctor to know, but you please disclose, because they have to come up with a way to save you, right?
We're trying to help you, so you need to help us to help you.
Yeah, they won't report you to the police. Hopefully not. Okay. All right. So we've already spoken a lot about the self-medication. We also spoke about the common reasons. We also talked about cost and accessibility about earlier. So right now, let's move on to the final question for the interview today. What is your advice to listeners about self-medication?
Okay. I think something interesting that you said, everything should be done in moderation. So yes, self-medication is not wrong, but you need to do it to a certain extent. It should be done wisely. So number one, you need to seek advice from pharmacists and doctors. But I think in those cases, it is understandable if you have mild symptoms, you want to self-medicate first. But if it's getting worse, seek help from us. The next one is, but in the terms of chronic diseases, it's not really advisable, because we've talked about all the risks and consequences which might lead to complications. So we need to think that although there is benefits, there are also harms. So the harms, I would say, generally, I would say first is waste of resources. Yeah. So for example, you bought the medication for a hefty price, like for example 200 ringgit for this supplement, which is supposed to cure everything that you have. So then you took it, but suddenly something felt wrong with your body. Then you went to see the doctor, and there's something wrong is caused by the medication. Then what happens? You need to throw away the medication. Yeah. Because like I said, one drug does not fit everyone.
And you might even be allergic to it. Who knows?
Correct. So yep. And also in terms of antibiotics, so if the doctor says you don't need it, please, they know best.
Don't ask for more.
Yeah, don't ask for it, because they know best.
Okay. All right. So but you know, we Malaysians always like to argue, and doctors say also argue still, like, how you know you are doctor? Oh yeah, you are doctor.